Dr. Walker, thanks so much for joining the program this morning. So I'd love to get your first impressions, both to the news we got from Moderna this morning, also Pfizer last week. And as you see vaccine progress, how encouraged are you at this point?
Thank you, Myles, and thank you, Yahoo News, for having me. I'm very encouraged. Very positive news coming from Moderna, and reassuring in the sense that it's different from the previous vaccine news in the sense that hospitals will be able to refrigerate it at a temperature that doesn't require new adjustments, and different in terms of distribution, just more closely related to traditional vaccines in the sense that it can be given once. But the next question is those priority groups, who's going to be able to get it, making sure that our most vulnerable have access to it and we're able to follow them appropriately.
And, Dr. Walker, obviously in financial markets, everyone is all very excited. This seems great. We can all look past the virus, but you're in hospitals, you're treating patients with COVID-19. You are seeing what's happening on the ground today. And so I would ask from that vantage point, as you talk about those distributional issues that I think we're concerned about, what would you like to see happen as vaccines get rolled out? And what does the vaccine need to address right now with the health emergency that is happening as we know it is happening in November 2020?
Well, the first steps is to make sure that it's a safe vaccine, and that's making sure that scientists have access to the data, we can evaluate the data appropriately. And then the second part is to make sure that we're intentional about the distribution and thoughtful about ensuring that we're able to not only prioritize vulnerable groups, but make sure that they're able to get it safely. As a physician, yes, I see the rates going up tremendously. In Illinois alone, we've had a 154% increase in hospitalizations throughout the past month, and it's palpable. So what we need to do is stay focused on masking, social distancing, washing our hands, making sure we stick to our bread and butter, and continue those habits in conjunction with the vaccine until we're able to get the rates at a level that can allow us to return to some form of normalcy.
Dr. Walker, apparently people are not doing what you're talking about and have not been doing what health experts have been recommending, or else we wouldn't be seeing the numbers as we're seeing them. Bring it home for us. Talk to us about what you are seeing and hearing from your colleagues in emergency room medicine. What are emergency rooms like where you are right now? What are you hearing from other people? What's at stake here, I guess, is what I'm asking.
What I hear from colleagues is a combination of fatigue, compassion, but we're reiterating a lot of the same issues in terms of masking. And there was a phenomenal article from The Atlantic that just demonstrated how difficult it is for us in terms of continuing to deliver that message. What we do now will set the stage in terms of how the next couple of months will go. And so what we've been trying to tell everybody is to be thoughtful about these holidays. Just keep it to nuclear families during Thanksgiving, as well as the upcoming holidays. Think of this as a team sport, and that we're masking each other to help save lives for our community, our friends at large, and that it's not trying to tell people what to do, but it's more so trying to protect our fellow community.
Doctor, do you trust that these vaccines, once they are in fact rubber stamped by the FDA, they will be safe for human beings to take? I'm sure you're not surprised, or you wouldn't be surprised to see the FDA has really been politicized during this election season.
True. I'm not a fan of politicization of science by any means, but I do believe in the peer review process, and I do believe that the leadership of Dr. Fauci will be able to give us a clear lens in terms of whether these vaccines will be safe. Like any drug that's introduced to any group, we have to be thoughtful on what those ramifications are, and as well as follow it long term. Although the data may only suggest 6 months, we have to continue to monitor what are some of the side effects of vaccines in general, so that we just are informed and can make the appropriate decisions.
And Doctor, our show is based here in New York City. Obviously, we were the center of the outbreak back in the spring, but where you are in Chicago right now is in a very acute emergency as cases continue to rise in that city. I'd love for you to just maybe tell us about the concerns that you have for your city as we head into the holidays. I know your mayor has been quite outspoken on trying to get people to do the things that they wouldn't normally do during the holidays. You know, don't have those large family gatherings. How concerned are you about the situation in Chicago today?
I'm very concerned. One thing that we tend to forget is that this vaccine has negative externalities past just the disease itself. If we continue to swelter our hospitals, our ICUs with COVID patients, it makes it that much more difficult for us to treat things that we traditionally treat on a regular basis. For example, if somebody comes in with a stroke, not necessarily related to COVID, but there's no ICU beds, there's no admission beds, the outcomes change dramatically. And that is what we're really fearful of. And we want to make sure that we're able to change this trajectory to the point where we can free up those beds and focus on patients like we normally do.